Okay, let's dive right into this. Today's explainer is focused on Loralai Medical College, located in Pakistan's Balochistan province. Now, we aren't just looking at a typical campus with classrooms and textbooks here. No, what we're looking at is a literal lifeline for an entire region. It's really quite a story. To really grasp why this institution even exists in the first place, we've got to start with this massive number: 400,000. That is the population of the Loralai district. Just imagine all those people for a second.
Now just look at this stark contrast. On one side, you have this massive, overwhelming demand, nearly 500,000 people. And on the other, a skeletal supply. Just 2 hospitals and 2 rural healthcare centers. That's it? To serve 400,000 people? It's a staggering, almost unbelievable imbalance.
And look, this wasn't just some logistical headache for administrators. It had a real tragic human cost. This severe shortage of medical staff led directly to some absolutely abysmal health indicators. We're talking incredibly poor immunization coverage and, heartbreakingly, really high child mortality rates. It was essentially a primordial medical desert where people had very little access to basic life-saving care.
So we come to the birth of a pillar and how they started decentralizing medical education.
Something had to give. They needed a major strategic intervention from the government to push medical infrastructure way out of the provincial capital. Now, what's really interesting about this slide is how rapidly this went from just an idea on paper to a functioning reality. In 2010, the plan to expand medical education to places like Loralai was mapped out. By 2016, the project was officially approved. Just 2 years after that, in 2018, the main academic block was finished, and the very first batch of MBBS students walked through the doors. And by 2021, they secured formal recognition from the Pakistan Medical and Dental Council. It is a beautifully structured timeline of really rapid progress.
Moving right along to academics and innovation, and how exactly they're equipping this next generation. So, okay, the buildings are up, but how do you actually train top-tier medical students out in such a remote, developing region? Well, you do it through a brilliant contrast. Outside the campus walls, you've got Loralai's rugged terrain and arid climates, very harsh conditions. But then you step inside the classroom, you are met with a state-of-the-art 3D virtual anatomy dissection table. This incredible piece of micro-level technology lets students interact directly with the human body digitally. They can map out accurate anatomy interactively without having to strictly rely on traditional physical resources. It's honestly a huge game changer.
And actually, that 3D table is just the beginning. The facility boasts 7 core preclinical departments, covering everything from biochemistry to forensic medicine. They've got a dedicated IT hub and digital library for online learning. Plus, there's this really ingenious book bank system where students can borrow those crazy expensive medical textbooks for the whole year for just a tiny deposit. Oh, and their exams? 100% multiple choice question-based, completely aligned with the latest national PMDC standards. It's a highly modern, comprehensive learning strategy from top to bottom.
Which brings us to polishing uncut gems, the real heroes of Loralai.
Because let's be real, a medical college isn't just about the fancy tech and the heavy textbooks. It's really about the incredible students sitting in those lecture halls. I absolutely love this quote from the college's principal, Professor Dr. Muhammad Salim. He says, "A need of sawing and grinding always exists to polish the trinkets, to make them glitter like stars. Loralai Medical College provides such polishing environment to the uncut gems." I mean, wow. It's such a beautiful, resonant metaphor, isn't it? It perfectly anchors our focus on the massive, untapped human potential of the region's youth. So who actually gets to be one of these uncut gems? Let's break down their 50 annual MBBS seats. The vast majority, 34 seats, are strictly for district merit. Another 9 are for divisional merit, that covers Loralai and Job, and the remaining 7 are reserved quotas for minorities, disabled candidates, or the children of doctors. What you'll notice is noticeably absent here: huge blocks of self-finance seats. This highly specific provincial quota guarantees that this institution serves the local residents of Balochistan first and foremost. So, the crucial point is how incredibly accessible this makes medical education for these local students. The total estimated cost is just between 35,000 and 50,000 Pakistani rupees per year. Because it is a heavily subsidized government institution, it actively removes the massive financial burden that we usually associate with medical school. This isn't just an education for the wealthy. It's a genuine gateway to equal opportunity. Now, let's look at the broader healthcare ecosystem and how they bridge the gap from the classroom directly into the community. You see, this college doesn't just exist in some isolated academic bubble. It directly integrates with the local infrastructure to provide immediate, tangible benefits. And this brilliantly illustrates exactly how that clinical hierarchy works. Step 1. The students get their clinical and tertiary care training right at the district headquarters teaching hospital. Step 2. They rotate through the local rural health centers to get real, hands-on community health experience. And Step 3. The college coordinates with 28 basic health units scattered all across the district. They handle vital rural research and run much-needed immunization drives. The students' training is literally reinforcing the entire district's healthcare grid in real time. Which leads us to the final piece, transforming regional impact and creating a true legacy of healing.
So what does all of this add up to for northern Balochistan? Well, the result is absolutely transformative. Being the very first medical college in northern Balochistan, it drastically reduces the grueling travel time patients used to endure just to reach Quetta for tertiary care. It is literally producing homegrown physicians who are much more likely to stay and serve these historically underserved areas. And because it's an active teaching site, it's driving major upgrades in local diagnostic and radiology equipment. It's become a true economic and healthcare engine that is genuinely serving humanity.
This brings us to a really fascinating final thought to wrap up today's explainer. When you combine strictly local student quotas, highly subsidized tuition, and cutting-edge digital learning right in the middle of a remote setting, you gotta wonder, could this Loralai uncut gems model be the exact blueprint we need to solve rural healthcare crises worldwide? It's an incredibly powerful example of problem solving that definitely leaves you thinking. Anyway, thanks so much for joining me on this explainer, and I'll see you on the next one.